We're talking to Doctors Faulkner and Stevenson about the transplantation of organs as well as organ donations. I think, Dr. Stevenson, before we had our first break, we were talking about some of the problems associated with organ donations among African Americans. But let's have you, as the chief of organ transplantation at Meharry Medical College, let's have you to give us some information relative to the procedures. I mean, when do you identify folks who need an organ transplantation and the kind of organs that they need, that kind of information for our audience this morning?
Yes, sir. As far as organ transplantation goes, patients who have end organ failure, meaning patients that are kidney patients that are on dialysis because their kidneys have failed to the point where they need to have their blood drawn out and goes through a dialysis machine so that it can be cleansed because their kidneys aren't working. These patients are candidates for kidney transplants. Patients who have end-stage liver disease from either hepatitis, from diseases such as primary biliary cirrhosis, secondary biliary cirrhosis, alcoholic liver disease. Patients like this who develop end-stage problems are candidates for transplant. Patients who have bad heart disease, cardiomyopathies, that will lead to their death in the future, in the near future. Very near future. These patients are candidates for heart transplants. Patients who are diabetics, who have developed renal failure, are candidates for pancreas and kidney transplants. There are patients who have bowel injuries and have developed what's called short gut syndrome. These patients require small intestinal transplants. Patients with end-stage lung disease, these patients require lung transplants. So all those organs can be transplanted in terms of solid organs. Then patients who need bone marrow because of various diseases, you can get tissue that way, cells. Patients, the reason why we use tissue like the lenses of the eyes, the corneas, the skin, long bones, because they're procedures that are used every day in orthopedics where they're using bone grafts. So that material can be used for that purpose. Patients who have been burned severely, skin can be used as biological dressings for these patients. So there are many uses for organs and tissue. It's just we have to get this idea across to the public as a whole, not only the African American community, but everyone. Now it turns out that we just donate at a lower rate, so we want to really hone in on these issues as to why. As far as the organ donor situation, patients who have irreversible brain injury, where the brain stem is not functioning, but the heart is still beating and the kidneys are still making urine, blood is still going through all the organs, keeping them alive, and that patient is on a ventilator so that the blood can be oxygenated, those patients become cadaver donors. Now, as far as kidneys, you know, if I have a brother or a sister, they can donate a kidney to me. I can donate a kidney to a parent. So as far as a living-related donor, you can have that. But cadaver donors are needed for all the tissue and the other organs. You can give partial livers. You've probably heard of people giving the left lobe of the liver to their child, things like that. So there's a situation where you have a living-related donor also. But the cadaver donors are those patients that have irreversible brain injury. Now, I know it's difficult for some people to go to the hospital, see their loved one laying on that stretcher in the ICU with the heart beating, urine in the Foley bag, the blood pressure monitor saying that the blood pressure is good, but someone is saying to you that your family member is brain dead. When in the next bed, someone's family member is not brain dead and they look the same way. They're lying because they're sedated, they're out, the heart's beating, there's urine in the Foley bag, the blood pressure is good. That sort of gives you some mixed messages. So that's why it's a very important and touchy issue for African Americans. I'm sure for most people, but we really have a problem with that because of all the things that we've heard about in the past. When African Americans think about situations such as the Tuskegee experiment, where African American men were denied treatment, not denied, but treatment was held when they had syphilis, so we could see what the long-term effects of that were. You know, when you remember things like that, you say, this is experimentation. I don't want them experimenting on my family member or myself. So we have to get over to the public that these situations aren't happening today as far as we know. You know, I really doubt that anybody's stealing organs and selling them. I doubt that anybody's pulling the plug before it's time. things like that. And I think it's going to take people like Dr. Faulkner, myself, Dr. Callender, and others to get out into the community to let people know that we, within the medical professional community, are willing to talk to you about it, to answer any questions you may have about it, to explain the situation. She knows about it from the end organ situation. I know about it from the surgical aspect of it. And so we can answer questions in tandem that you may not have gotten from just reading the paper or something. But any type of information that can be passed on to the community is very important.
Very good. Dr. Faulkner, excuse me, I think that when we talk about the donation of organs, you represent an organization that has national implications. And let's talk about that organization and what are you trying to achieve as a member of that organization out of Nashville, Tennessee, out of Meharry? What are you trying to achieve?
Well, that program is the MOTEP program. It's the Minority Organ Tissue Transplantation Education Program. And through that program, we try to do just as Dr. Stevenson has said. We try to increase the awareness of organ donation among the minority communities. We try to encourage organ donation and the signing of organ donor cards. And we try to make sure that an educational program is set up where people can call in and get questions, or we can go out and talk to different people or different groups in the community. Through that organization, we've set up an advisory board. And there are several people on the advisory board, including Dr. Stevenson and myself.
Well, now, and let me follow that up by raising this question. I think Dr. Stevenson hinted at it just a while ago. But when people say that organs can only be acquired by those who have financial resources and et cetera, that this is not a poor man's game, so to speak, what would be your reply to that?
Well, organs are not bought. Okay? People are placed on the transplant waiting list. Now, for kidneys, the government takes up the cost of transplanting those patients. And they take the cost of those people who want to donate a kidney. The government pays that cost as well, because it costs us about $35,000 a year to maintain one person on dialysis, and there are 200,000 people on dialysis in the United States of America today. It costs the government $30,000 to $35,000 a year to maintain those patients on dialysis for each patient. It costs between $35,000 and $60,000, depending on whatever institution transplants a patient, to do one kidney transplant, and about $4,000 a year to maintain the transplant after it's transplanted. So the cost is not an issue so far as kidney transplantation.
Okay, let me interrupt here and by saying that it's cost effective for the government to do that. And let me stop with this commercial, and we'll be back with you following this commercial break.